Coming up, we'll be on location at Biofeedback WORKS in Herndon, Virginia, discussing the latest advances in mental health treatment and how it can help improve your mental health, wellness, and life utilizing biofeedback and neurofeedback. Safe and effective modalities with one of this region's top mental health experts, Dawn Perez. Dawn is the clinical director and owner of Biofeedback WORKS. Welcome, Dawn. It's a pleasure having you back on our program.
Thank you. It's a pleasure being here.
We have a lot more to talk about today, and we're going to hear from two of your colleagues as well a bit later. But I wanted to begin by having you please tell us about how you all have been providing neurofeedback and general feedback services for over 17 years now throughout this region. Now, how have you seen this field change over that time? Because I'm sure you've seen it all.
Biofeedback, neurofeedback has actually started for 40 years and evolved, but in the last 10 years of that 17-year dedication to this field, things have just leaped incredibly forward in terms of the technology being able to support what we're doing now. And when I first started, we were doing very simple protocols, which are still highly effective, but 1 or 2 leads on the head. We call them amplitude training. But now we have stepped into a world of full cap training quite as a norm, and working on every site on the head and working on the connectivity between them in deep structures as well, called S-Lorettas. And as well, there's so many other devices and at-home use devices, but also highly technical, and that we're bringing into the clinic to utilize and augment what we do with the neurofeedback treatment. So the world is opening up.
Yes, indeed. Now that leads me to my next question, actually, and that is, what are you doing specifically that's new and different here at the clinic at Biofeedback WORKS?
Well, thank you for asking, because I'm very excited to sort of announce that we have felt that this is something that we want to offer to more people. And so we've opened up a part of our clinic called the Brain Body Suite. And we are trying to allow people who come into the clinic and our clients to utilize this with an open door philosophy, where they can come in during the month. They can sign up at will, and we will have devices available for them that, as I said before, like to augment what we do. So heart math, which is a breathing technique, and something called the peanut, which is a HEG or frontal lobe sort of kind of training program. We have a lot of other things in there as well, plus the assessments that we use. We're doing the Cambridge assessment right now, which is a different segment of looking at how people function, and we're using that as a comparison to our baseline, creating a baseline comparison to at the end of our training.
Yes.
So we're really excited to offer that. I think it's more flexible, and it's taking out some of those little pieces that we've been trying to squeeze into a session, and allowing our sessions to really be designated for the real neurofeedback, which is becoming more intense and taking up more time, so it's necessary.
Yes, indeed. The latest and greatest through the advancements in technology, and you all certainly have that here at Biofeedback WORKS. Now, I also wanted to ask you, Dawn, what is coherence in the brain? Can you explain this in a way that illustrates its effect on helping those with mental health illnesses such as depression and anxiety, which are very common issues in so many folks?
Right. Well, and they're part of other bigger picture problems that we're seeing. So when we talk about depression specifically, we're talking about an imbalance in the brain. And generally, the left side of our hemisphere runs faster than the right. And that can be in terms of, the technical term would be hertz, what the wavelength is that's running there, but also amplitudes of slow wave versus fast wave. And when you talk about coherence, is that we want to run faster on one side than the other, which internalizes sort of what's going on in the coherences and how they talk to one another from front to back of the brain or left to right of the brain. So we think about speed when we talk about coherence. We think about effectiveness, like how effective is that communication between these parts of the brain. And now as I said, our field has advanced so much. So when I first started, we were thinking about coherence as kind of a surface issue.
Yes.
Now we know we can do a trajectory and actually see in a 3D perspective, real time, while the client's sitting in our chair, what the coherence looks like in the deeper structures of the brain.
Wow.
So the deeper structures can be parts of the brain that people maybe have started hearing about but aren't that familiar with. But we certainly can talk about gyruses, lobes, frontal lobe, parietal lobe. Parts of the brain that we talk about a lot are the cingulate, and that runs right down the middle. So we're utilizing all of these technologies to view and then be able to train these deeper structures. And the coherence of that is very, very important to how we think.
Absolutely. Very well said. Some great points indeed. Now, you also have a lot of diversity in your client population, from what I understand. I understand that you see a lot of children and adults on the spectrum. Mm-hmm. That brings up a lot of curiosity for me, Dawn, and that is that now are people with autism or learning disabilities, are they being helped with neurofeedback, especially if learning is an issue for them? Can you please tell us about that?
Well, what we said before is that to get the feedback, we have to be able to appreciate that it's positive feedback, right? It's a reward system.
Yes.
And so a lot of people do bring that question up, because if you're having learning disability, can you learn because of the positive reward? And the answer is yes. The positive reward is really communicating with the brain, and our cognitive senses, our ability to track that, aren't fast enough. The brain is much more complex, and it can track the rewards that we give in terms of auditory rewards or visual rewards. It can track those things quicker than we can see them and think them, so in nanoseconds, and which makes it possible for an autistic child who has no verbal ability to sit and be somewhat entertained, or at least watch something that keeps them somewhat steady and calm, and receive rewards, but they have a difficult time getting in other modalities that help the brain start connecting those coherences, those brain waves, and form neural pathways that weren't there before, for speech, for example, or for the stuckness that you sometimes see in terms of stemming, in terms of rigid thinking, or very isolated, specific thoughts that some people on the spectrum have. We can help make that more flexible by looking at the different structures of the brain, the amplitudes and the coherences, and help that brain become more. We're not going to make anybody a copycat of a norm, but we're using their information against a norms database.
Yes.
And so we give them positive reward for getting closer to that norms database, and they start lightening up and becoming, very interested in other things that they weren't interested in before, having more verbal communication in that community. The social network is very important, which is back here in the back of the head.
Yes.
And so sometimes that's where learning takes place also. So we're able to enhance that area so that they can take on more. And it's very exciting.
Yes, it is. And I love the fact that overall approach here, in addition to having highly experienced practitioners and colleagues, to all of you all working here together to help so many in the community with what you offer, throughout the region. You got folks driving distances to come here to utilize you and your colleague services here at Biofeedback Works. But also, I love the fact that in addition to the latest in technology as well that you offer here, as you've touched on today, I love the fact you look to help each of your clients find the root cause of what that problem is, instead of a Band-Aid approach, if I may use that simple term. And I love that. And your patients, your clients here actually love the results they're getting, and we're going to have them on in one of our upcoming interviews. You're going to hear from a number of them, but some great work you're doing here, Dawn.
Thank you.
You and everyone here at Biofeedback Works.
Thank you.
Now, speaking of those who have disabilities, Dawn, does neurofeedback help people with brain injury, strokes, or even people suffering from dementia, for instance?
Yes, because everybody who walks in here walks in with a brain.
Yes.
And the brain is something that we can rely on being flexible, and plastic is the term. So it's always something that we think we can help with. We certainly can do an assessment on, and have helped many people with TBIs or brain injuries.
Yes.
It's caused a lot of inflammation in the brain, so that's why we've moved to providing some inflammatory devices that help to bring down that inflammation.
Okay.
Other situations that cause brain injuries that people don't think about often are mold or toxins or Lyme disease, because there's that inflammation that occurs, and it can, like with Lyme disease, it can occur in the joints, and people are familiar with that. But when it gets past the blood-brain barrier, it becomes inflammation in the brain. And so we are trying to address the needs of our clients by, with that. Neurofeedback will bring down inflammation.
Okay.
And the same thing with people with some dementia, such as Alzheimer's. One of our devices, called the V-Light, has been researched to help break up the plaques that develop around each neuron, the cell itself. And so we know we're making some inroads in terms of that. And again, overuse of a brain doesn't have to be Alzheimer's, but just old age dementia in that regard just needs support sometimes.
Yes.
And so we're helping, again, those coherences to reconnect. We're helping the amplitudes to be more balanced, and it certainly can make an effect in any of those people with disabilities.
Yes, indeed. And what ages of clients does neurofeedback help? And how young can a child be where it's appropriate to start neurofeedback, if I may ask?
Yeah, that's a great question. Our databases that we use start at 4 years old up to 80 years. So
talk about one end of the spectrum to the other.
Right. And really it comes down to the ability for the 4-year-old to sit and receive the feedback. And that happens usually because we love kids. And so when they come in here, we're all excited to see them. And they get a lot of positive reward just by coming here. They sit in the chair, they let us mess with their head. It doesn't happen the first day, but eventually we get to start training them. So we work really hard to make that something that we earn their trust.
Yes.
And that's important. And we've come up with tools for people on the other end that I had one family that created a videotape of their family for somebody who was having memory issues. And that was really fun because while she was watching her family, it was bringing up memories for her and reinforcing that as a positive reward. So
yes, absolutely.
We'll do different kinds of things depending on who's here.
Yes, you'll mix it up a little bit, right?
Exactly.
It's not cookie cutter. That's another thing I love about your approach here at Biofeedback Works, is that you customize the appropriate plan to help each of your clients achieve their respective goals. Because really, we're all different, right? And even though we may have something similar to someone else, everyone's a little different. And you factor all that in your assessments and your evaluations, and then your, what the next steps are to help each of them.
To add to that, when we're doing that kind of work with somebody and they come in and they say, well, I've been diagnosed with anxiety. And I always have to ask, well, what does that mean for you? Because anxiety looks like anxiety. We can define it on the outside, and that's where we get our diagnosis.
Yeah.
But internalized anxiety, in the brain anxiety, can be very different depending on where it exists and what's causing that in the brain. So I don't depend on diagnoses as much as I depend on what the brain looks like and how the behaviors are presented. And with the help of the client, we work through those details and are able to, as you said, define a protocol that has to do with that individual.
Yes, and that's where your technology comes in as well. You combine the best of both, and from the human perspective and the technological perspective to achieve optimum results for your clients, which you certainly are doing. Now, we're literally out of time, and I wanted to ask you about the COVID issues that have started to be heard of, called long haulers, if I'm not mistaken. And fuzzy brains is another term, right? I wondered if there are similarities to those people who have had chemotherapy and other types of illnesses that cause brain fog, for example. If you could tell us a little bit
Sure.
more about that.
So I think it's very important to note that there are people that are out there that are struggling after having COVID. And even, unfortunately, some of the vaccinations have brought some things up. But we are dealing with helping those people, again, in my way of looking at it, it's an inflammation problem.
Yeah.
So something is creating an inflammation in the brain when it's brain fog. We're getting too much theta, too much slow wave, and that can be helped by asking that slow wave to come down.
Yes.
So chemo brain, people refer to it, is creating a lot of stress on the brain, and sometimes the brain uses resources inappropriately to get through that period of time.
Yeah.
And so if we can just set it back with a little reset and get the brain sort of balanced and back in gear, it will come back.
Yes, indeed. Well, on that note, Dawn, I'd like to thank you so much for joining us again, educating us as well as you always do, and really helping so many of us understand about all that is happening here in Biofeedback Works between you and your staff, your colleagues, and all the folks throughout the region who are, as I mentioned earlier, driving all sorts of distances and even flying in from other parts of the country to utilize all the expertise and care that you all are providing to so many folks to help each of them. So we want to thank you for joining us, being a guest again on our program, and would love to have you back on in the future.
Thank you so much. I appreciate it.
Oh, it's my pleasure. We're now going to hear from two of your colleagues, in fact. Welcome, Lynn. It's a pleasure having you on our program today.
Thank you. It's a pleasure to be here.
I understand you're a neurofeedback provider here at Biofeedback Works. I wanted to begin, if I may, Lynn, by having you tell us about some of the benefits of neurofeedback for children and teens.
Well, the benefits for children and teens are really not just for that individual, but the benefits are for the whole family. Because when a child has a behavior problem and gets too angry too quickly, too frustrated too quickly, it makes a problem for the whole family. So the benefits are really far-reaching and long-term. One of the things I like to see after about 6 or 10 sessions of neurofeedback is the parents will tell me that the child is not getting angry as quickly as they used to, or when they do get angry, it takes them much less time to calm down again. And that makes the family work better.
Yes, indeed. No, that's a very good point. Now, how do you start with the child, if I may ask?
The first thing we do is a QEEG, or brain map. And then from the results of that brain map, we look to see if there are areas that the brain is working too hard, or if there's areas where the brain is not working hard enough. So when a child has too much theta in the front of their head, their executive processing is not working correctly. They make bad decisions, and they may be very impulsive. So what we try to do then is train that area down. We try to bring the theta down so that there's a better balance in the front of their head. And then symptoms will start to fall away.
Very interesting. Now, what if the child is anxious or has had some past trauma, Lynn?
So what we see in a case like that is they'll have not enough alpha in the back of their head. So if they have too many fast waves in the back of their head, then we'll try to train that down. And what we frequently see with anxious teens, because they're more verbal, is they'll say they have more friends, or they'll say that they're not anxious anymore, and that things just at school and at home are just going more easily for them.
Now, is what you see in a brain map always so straightforward?
No, that's a good question, because a lot of times in both children and adults, what we see is sort of a mix of things. Some too much theta in the front and some not enough alpha in the back, all in the same brain. And sometimes what I see frequently is the child or the adult has had some type of head trauma where there was a hit to the head, whether it's falling off a bike, getting in a car accident, falling off the bed when they were even a young baby, that they have some problems that could be ADHD or behavior problems or attention problems. And really what it is they've had a head injury, and the head injury changed the functioning of their brain. And so what we try to do is correct that balance and overcome that problem or issue that they are experiencing.
Yes, indeed. Now, as a provider of neurofeedback, Lynn, what stories do you like to hear from the parents as far as feedback goes?
After 20 to 30 sessions, we love to hear stories about things like, we went out to dinner for the first time and the child sat for the entire dinner without getting up 6 or 7 times. Or that they have more friends at school and they're being more social. So things like that are very valuable to us, and it makes us feel good that we're actually helping this child.
Yes, indeed. Now, we're almost out of time, but I did want to ask you before I let you go, Lynn, with this being such a technical field that you're in, and Biofeedback WORKS has expertise in, how do you stay current with what's going on?
Well, I'm board certified in neurofeedback, which is an accreditation that we get. And I also go to the ISNR conferences every year to stay current, and that's a 4-day event, taking lots of classes in S-Loretta training or connectivity training or multivariant training, things like that.
Yes, so you stay totally abreast like everyone else does here at Biofeedback WORKS on the latest trends and staying current with everything to help so many folks in the community. And on that note, I'd like to thank you, Lynn, for joining us, being a guest as well. It was a pleasure having you on.
It was a pleasure to be here.
Thank you.
Thank you.
Welcome, Archana. It's a pleasure having you on as well today with us.
Thank you. It's a pleasure being here.
Now, you are a clinical psychologist. You have years of experience. And I wanted to begin by asking you, as a psychologist, how does what you do here at Biofeedback WORKS, working in the field of brain therapy and QEEG assessments, inform your view of your client?
Sure. So I'm going to start by saying I've been a psychologist, a clinical psychologist for about 20 years now.
It's a lot of experience.
Yes. And when I heard, I'd been attending a conference, Networker, which is very popular here for many years. And I heard Bessel van der Kolk. He's a psychiatrist, a neuroscientist. He's written published multiple articles and papers on neurofeedback as well. And so when I heard him talk about neurofeedback, I was pretty intrigued and I wanted to learn more and explore more on neurofeedback. And it has completely changed how I see the client now and the clients I deal with, because neurofeedback is really it's a very viable, it's a very fast, it's very efficient, it's very effective way of helping and treating and healing people.
Yes, indeed, Archana. Now, does doing a QEEG tell you different information or suggest other therapeutic interventions that you wouldn't have used otherwise, such as drug interventions, for example?
Right, absolutely. So when we do a QEEG assessment, we are able to identify different structures of the brain which relate to the symptomatology of the client. So we are not going by the diagnosis, we are going by what the client is presenting with and how it's represented in the brain. So we are targeting the brain structures by doing an assessment. So when we do a brain assessment, it's a very cost-efficient way of doing an fMRI, let's say. And you are able to recognize and you're able to see some of the deeper structures of the brain with different symptomatology as the client presents with.
Very interesting.
Yeah.
So that leads me to ask you, Archana, why don't more mental health practitioners, such as psychologists like yourself, for example, or even neurologists, use this form of assessment more often to inform their decisions of prescribing medication?
So there are actually, it's really coming up now, and the field is really coming up, and there are more and more practitioners who are getting more interested in it and who are beginning to practice. I've had a lot of colleagues who have asked me questions about it and who are reading more about it, you know, especially after Bessel's book on Body Keeps the Score. It's really come up quite a bit. I wish it would be more.
Yes.
Because like I've mentioned, it informs, it's a different way of, you know, just treating and helping people.
Yes, it
So wish it would be more, but it is there. It could be taught more in the schools and the undergrad programs and the grad programs, and that would be really helpful. Yeah, but we have a really strong and a solid community, which is very, what would I say, very supportive community in the neurofeedback field. So if somebody would be interested in doing this, I would really encourage them to go about it.
Absolutely. Now, what is the importance, Archana, of QEEG, assessment for trauma and other complex diagnoses?
Yeah, so again, being a psychologist for many years, I have specialized with trauma and PTSD and other diagnoses as well. And what I would say is that trauma presents differently with different ages, and how it has, it could be a one-time traumatic incident, or it could be a complex trauma that we have, that somebody has experienced over and over again for many years. So here in our practice, we usually see more complex PTSD and we see more complex trauma. And when we do a brain scan, we are able to recognize different, like I was talking about, deeper structures of the brain. So we are able to recognize, for example, structure like anterior cingulate cortex, which is really impacted when there is, when a client presents with trauma. You know, you have other deeper structures that get impacted, like insula. We can really target that with the brain assessment. We know that this is, you know, you can, like I was saying, we can recognize that these are some of the structures, precuneus, insula, posterior cingulate cortex. We can work with these deeper structures and help the client to really emotionally regulate themselves. And I hear clients saying for the first time in many years that they slept well, or they were able to interact well with their children, or they, you know, did something that they hadn't done in many years.
Improving their quality of life, in other words.
Absolutely, their day-to-day functioning.
Yes, which is so vital.
Absolutely.
Until we aren't able to do that. Then you realize it.
Right, yeah.
Now, we're literally out of time with you as well, Archana, and I just wanted to ask you, what changes would you expect to see in your clients with neurofeedback, biofeedback, and how different are they than other therapies?
Yeah, so again, I'll keep going back to my, you know, basic training as a psychologist. So it's very different from a traditional CBT or talk therapy. So here you're really working directly, and a client would be able to sleep better, you know, improve the overall functioning as we were talking about, reduce their anxiety, reduce the depression, reduce just feeling comfortable in the environment around you and within you, because again, trauma impacts all of that.
Yes.
Trauma, you know, you may not feel safe in the environment around you. You don't feel safe within you. So it not only helps to emotionally sometimes downtrain when there is a lot of emotional arousal, helps to regulate you. And sometimes when it is, you know, there could be hyperarousal, there could be hypo, which is less. You're able to, again, regulate the client and just perform better, have an optimal functioning overall.
Yeah, just better overall, as you said.
Yes,
absolutely.
optimal functioning, yeah.
Now, on that note, I'd like to thank you, Archana, for joining us, enlightening us, and educating us, and being a guest on our program. Certainly a pleasure having you on with us today.
Thank you so much.